Namaste सभी को. Good evening to all. I welcome you all on this occasion of Ayurveda Day celebration. I welcome our esteemed chief guest, Dr. Dipti Godbole Madam, who is Associate Professor in the Department of Shari Rachana at STM Institute of Ayurveda and Hospital, Bangalore. And she is quite good, having expertise in Marma Chikitsa. This year, Ayurveda Day, we are going to celebrate this Ayurveda Day on 29th of October. And Ayush Ministry has declared Ayurveda for global health and innovation. So this year's theme is Ayurveda for global health and innovation. On this theme, we are going to celebrate this International Ayurveda Day with our esteemed speakers, the chief guest, Dr. Prashant Suru sir, Dr. Manisha Thakre ma'am, Dr. Amol Bansode, Dr. Abhishek, and Dr. Dipti. So I welcome you all. डॉक्टर दीप्ति ये काफी मर्म चिकित्सा के साथ साथ जो भी सोशल वर्क है, अलग अलग प्लेटफॉर्म पर लेक्चर्स उन्होंने दिए हैं एंड अलग अलग रिसर्च पेपर्स भी उन्होंने पब्लिश किए हैं. सो एक एस्टीम्ड स्पीकर आज हमारे साथ है डॉक्टर दीप्ति. सो आई वेलकम यू ऑन बिहाफ ऑफ आयुर्वेदा वेलफेयर फाउंडेशन एंड वी आर गोइंग टू स्टार्ट दिस सेशन ऑन मर्म चिकित्सा. सो मैम वेलकम, you can start your session.
Yes, ma'am. Ma'am, is it audible?
Yes. Clear. Okay. Is it clear? Yes, एकदम clear है. You can start. Yes. मैम अभी शेयर हो गई थी पीपीटी. And this session is live on our YouTube channel.
Ma'am, can you hear me now?
Yes.
Screen is visible, right?
No. Not ma'am.
Screen is not visible?
No. The PPT is not shared.
Oh, 1 minute.
Just try once.
Now is it visible?
अब इस आगे स्क्रॉल करिएगा. पीपीटी तो नहीं दिखाई दे रही है.
नहीं दिखाई दे रही है.
हाँ, अभी दिखी थी लास्ट टाइम जब आपने शेयर किया था, बट अभी तो नहीं है. आई थिंक आपने इसको ही ये अलग से कुछ शेयर हो गया है. स्टॉप करिए. आपने स्क्रीन पूरी शेयर कर दी है शायद, तो पीपीटी के ऊपर क्लिक करिएगा. पीपीटी ओपन है मैम इस पर डेस्कटॉप पर?
हाँ, स्टॉप किया मैम.
नहीं डेस्कटॉप पर पीपीटी ओपन है ना, तो अभी ट्राई करिए एक बार.
अभी नहीं दिख रहा ना?
नहीं शेयर ही नहीं हुआ है. नहीं, ये आपने कुछ अलग शेयर किया है.
अलग शेयर किया है?
हाँ, वो मतलब वही पे क्लिक नहीं किया. आप पीपीटी के ऊपर पीपीटी पे क्लिक करिए मैम.
select
हाँ, अभी आ गया. yes ma'am, it's clear now. You can continue. Yes.
It's visible now, right,
Yeah,
ma'am?
yeah, yeah. Yes.
Okay, ma'am. So, good evening, one and all. So, hereby I first of all thank Dr. Shilpa Irma Madam having given me a platform to share some knowledge that I'm having on Marma Chikitsa or Marma therapy on account of National Ayurveda Day. And so, without wasting much time, let's actually start with the topic. So, as we know that the topic is on Marma therapy or Marma Chikitsa. So, two words are there. One is Marma, another is therapy, or another is Chikitsa. So, Marma is having many meanings as such. So, to start with the Nirukti, simple Nirukti, we tell it as Jiva Sthanam tu Marmasyat. So, where there is prana or where there is Jiva, that point, that vital point, we call it as Marma. Fine. Next, we also have the definition as Marmani Jiva Adharani Prayena Munayo Jaguhu.
Dipti?
So we have that also.
Yeah.
So Jivasthana, Marmani Jiva Adharani Prayena Munayo Jaguhu. Even our ancient scholars and rishis are of the same opinion that so where there is life or where there is Chetana, where there is Jiva, which supports our prana, so there that point we call it as Marma. Okay. तेषाम् अन्यतमं पीडायां समाधिकपीडा भवति चेतननिबन्धवैशेष्यात्. So what can happen if there is an injury here? There can be pida, there can be vedana, there can be dukkha, there can be a lot of pain in this region as such. Okay. Then Vishmam Spandanam Yatra Pidete Rupcha Marmam Tat. So Spandana, when we press on that particular vital spot, so wherever we spread or wherever we're palpating on that marma spot, so if there is pain, then there is some amount of injury to that marma as such. Okay, then we have another thing is Mara Intiti Marmani. So Mara and Teti were directly should not be taken as death here. So Mara and Teti means when there is an injury. So certain cases only in only trimarmas in such cases it can lead to death. Otherwise it can lead to other things like disfigurements. It can lead to disabilities, different types of disabilities, or it can lead to too much of intensified pain. Different types of pains which is seen in more intensity. So that we have to take here for the word as Marayanti here. Okay, so Dukkhadayitvat iti marma. Dukkhadayitvat means that which gives so much of vedana or pain to the spot where it is injured. That also we call it as marma. Then what are these marmas? How do we identify the spots of marmas? So if we want to know that, then we also know that marmani mamsa sira snayu asti sandhi sannipataha. That means it is the point where we are going to see the different components like mamsa, that is muscles or musculatures which are there as structures. Sira, we are going to see the different blood vessels, maybe veins, maybe the arteries, and then we have snayu, ligaments and the tendons, and asthi, which are directly the bones, sandhi, which are the joints. So you take any marma among 107 types. So any marma is constituted or having the components in the form of mamsa, sira, snayu, asthi, and sandhi as such. Okay, so teshu swabhavatah evam visheshena pranas tishthanti. So by nature, by default, there is prana in whichever marma we are going to see. So among 107 or 108 marmas, what are there? So in every marma, there is by swabhava, there is prana in this marma site as such. Okay, so that is how, because these are the surrounding structures to any of the marma, the classification also has been made on this criteria itself. So, like we have Mamsa Marmas, we have Sira Marmas, we have Snayu Marmas, we have Asti Marmas, we have Sandhi Marmas, because these are the areas where we are going to see the different locations of the different Marmas as such. So, then how many we have? We have Saptottara Marmashitam. So, some 107 Marmas we are having. Okay, so I'm not going to tell you the details of this marma as such types classification. I just want to show you the numbers because our topic is on chikitsa or therapy aspect. So let's go directly into that. But before that, just I want to show you the marmas and tell you the names and number of that. So, for example, if we are taking as Rachana Anusara, okay, there is so Prana, Sadhya Prana, Haramarma, etc. All these are the examples of Rachana Anusara. Structural classification, we also call it as. So then we have Aghata Parinama Anusara, depending on the effect of injury we are having. Regional classification is Shadanga Anusara. Shadanga Anusara in anatomy is So where we have Urdhva Shakhagata, Adho Shakhagata, upper limb marmas, lower limb marmas, Urogata marmas, that means thorax, those which are related to the thorax or the chest cavity, and Udaragata marmas, those which are related to the abdomen or the vital organs. Then we have Shiras. Okay, Shiras and the lower back region. Kati Pradesha is lower back region. So like that, Shadanganusara also we have different classification. Next we have Sankhyanusara. Like Sankhyanusara is 107. So for example, if we take Sadhyo Pranahara, it is 19. Okay, then we take Kalantara Pranahara, it is 33. Then we take Vaishalya Agna, it is 3. Vaikalyakara, we have 44. Then we have Rujakara as 8. So like this, when we count, we get it as 107. So like this, we have different areas of classification depending on the Sankhyanusara also. Parinamanusara is depending on the dimension of the marma. Some are angula pramana, some are ardhangula, some are dvayangula, some are trayangula, some are chaturangula. Like that, based on that also there is classification. So Sadhya Pranahara, the person will die in 7 days if it's not treated in time. Kalantara, there is a time limit. So 15 days time limit, or Pakshat Masat Va Marayanti is what they tell. Pakshat means within 15 days, Masat means within 1 month. Vishalyagna, as soon as the foreign body or the Shalya is removed, the person will die. Okay, Vaikalyakara is which calls the Vikalata, Anga Vikalata, deformity, different disabilities. Anatomy is all about the structural elements, right? So obviously Vaikalyakara is one of the very good example in this case. Ruchakara, we can see different types of Pidas or this one in that. Okay, these are the names and these are the names you have to be familiar with. So for knowing how to do the Marma Chikitsa properly as such. So Shakha Gata Marma, we are having 44. How does it become 44? So 22 in the Urdhva Shakha Gata, 22 in the Adho Shakha Gata. That means in each Shakha there is 11. So 11 into 4 is what it becomes 44. So Udara we are having 3 marmas, that is abdomen. Uras we are having 9 marmas. Prishta back region we are having 14 marmas. Chaturdasha and Chatrurdhva in the head and in the head and neck region totally we are having 37 marmas. Okay. So, and there is one more additional marma classification, Dhamani marmas, which is told exclusively by our Vagbhatacharya. 9 Dhamani marmas are there. And the composition is also important to be known. Sadhya Pranahara is having the composition of Agni Mahabhuta. Kalantara has Agneya and Saumya. Vishalyagna is totally Vayu because Shalya is impacted inside. If you are removing, the person will die, so it should not be removed. So if it falls on its own after the wound has been completely healed, then there are chances of the person surviving as such. Vaikalyakara is Saumya by nature. Rujakara is obviously we can understand by seeing the word itself, Agni and Vayu as such. Okay, so with this introduction, let's see what is Marma therapy as such uh, today. So let's go back to our ancient days. So in our ancient Vedic times, these were called as Bindu. Bindu means a small point or a dot or a secret dot or a mystic point. Like this, we have 107 points. According to Unani Siddha system, they call it as 108 marmas. So they include Shiras also as one of the marmas separately. So that's how it becomes 108 in them. Okay, so we denote it as Bindu or a dot or a mystic point. So this is a junction of the body where two or more types of tissue are going to meet. So just a few minutes before I told you, Mamsa, Sira, Snayu, Asti, Sandhi, where they meet, that junction, that point, that bindu, we call it as Marma. So this was known to the kings and the warriors at that time because this was for self defense. Okay, so when they used to have war in the battlefield, so to prevent from any injury or to defend themselves, so this was the concept. Martial arts was there. Similarly, Marma Chikitsa also was there, so which was acting like a self defense. Okay, so to prevent themselves from different types of injuries. That is what that was happening in the battlefield. Okay, so it was used both in warfare as well as in surgery. Okay, so from common ailments to serious neuromuscular diseases, we can see so many diseases or disorders can be treated by Marma therapy. So, common ailments, for example, we take a simple indigestion case. So, till where, till cerebral palsy or till other paraplegia, etc., things, we can have a very good, promising results through our Marma therapy. So, common ailments are like headache, body ache, faulty spinal alignment, joint pains, different areas of joint pains. Okay. So then this is what type of therapy? This is a gem of Ayurveda. They call it as a gem of Ayurveda. This is a non-invasive therapy in which gentle stimulation is done. So we stimulate every point there. So whichever site is affected, whichever point of marma is affected, we try to give a gentle stimulation. Okay, so we try to stimulate it by giving either a massage or by doing some treatments like panchakarmas or by giving the pressure, proper pressure to that particular site of the injured site of marma. So why we do that? It is done to instigate the flow of prana, which was occluded due to the disturbed flow of vata, because we call it as Jivasthanam. So throughout there is prana in this. So wherever there is an injury, whichever point marma, whichever site of marma is injured, obviously the jiva or the prana will be obstructed there, right? Avarodha will be there. So to remove that avarodha, we need to instigate by doing this marma chikitsa. Once we are doing this marma chikitsa, then automatically the obstruction starts getting relieved slowly. Once the avarodha has been cleared, then automatically the vata dosha will come to its normal state. Okay, so because till now there was disturbed flow, so once we have channelized by applying pressure on the marma points, initiated the therapy, so obviously the vata will come to the normal state and thereby the person will have the instant relief. So our main aim of doing this marma therapy is to provide instant relief. That is why it is a very good motivation for all the Ayurvedic surgeons. Okay, so to do this marma therapy, because no prescription is needed, it is non-invasive, and once we teach the patients this the marma therapy, so the person can also do on his own self marma therapy. We call it as self marma therapy. So a point where a stimuli begin to produce a sensation, lower limit of perception. So the moment the person comes with some pain in a particular site, so when we are giving a pressure, so when we are even at giving a pressure at a minimum pressure also, if the person is feeling that pain, okay, that we call it as pain threshold. Okay, so minimum pressure of the stim, either by stimulating it, palpating, or giving the pressure. So at a minimum level, when the person reaches the pain, means that means you imagine how much may be the intensity of the pain for that particular person there. So that we call it as pain threshold. Okay. So these are not only anatomical landmarks, but they are also the sites where tridoshas are present in their subtle forms. So tridoshas are our vata, pitta, kapha. They are present in their subtle forms as prana, ojas, and tejas. Okay, agni, mahabhuta. That is how we are going to see their subtle forms. Other than that, they have three gunas also. Sattva, Sattvika, Rajasika, and Tamasika gunas are also there. Bhutatma is also there. We have a shloka for that, right? Bhutatma cha avatishthate. So there it has three doshas, it has three gunas, and then in this we have that shloka, right? If you are remembering that, Soma Maruta Tejamsi, Rajaha Sattvam Tamamsi cha. So first line we are talking about the gunas there. Marmasu Prayashah Pumsam Bhutatma cha Avatishthate. Bhutatma is also there. Avatishthate. Marma Swabhihatam Tan Tan Jivanti Sharirinaha. So this is a beautiful shloka that talks about the composition of our marma. So then what is this therapy? Manipulating or stimulating marma in the management of various diseases is what is known as marma chikitsa or marma therapy. Okay. So next, so how do we define this? We define it as a natural. Okay, so nothing is artificial. We know the marmas, where they are located. We know the nature of the pain. We know the cause of the pain, right? So naturally, we are going to give the pressure and relieve the pain of the patient there. Non-invasive. We are not using any instruments here, or we are not using any equipments here. Instant here implies to the moment the person has come with a bad pain, leg pain, knee pain, whatever, joint pain, etc. So we are going to give him the relief and permanent method of healing. Right? This is the permanent method of the healing. Okay, today you give the marma chikitsa, may not be, maybe some 10-20% he may have the relief, but certainly when he does it every 2 times daily, at least on regular basis, then the intensity of the pain will be totally very less day by day. So it's a permanent method of healing actually. And one more thing I would like to say is, after when you are learning about this marma therapy, when we are talking so much about this, so many people will not believe this. They don't have the faith in this marma therapy. What is that in that? Like just giving the pressure, and these people say such a bad pain also will be relieved. See, you should have faith in what you're doing. It's very simple, it's non-invasive, but when we learn the actual right method of doing this, certainly the people will have very good relief. I have done in my I keep doing in my OPD, so along with the other cold treatments, I think you also have done and seen the effect. So this is a small thing, but having faith is very very important from your end as well as from the patient end. So what all we can really resolve by this marma chikitsa is, we can relieve the scoliosis, again anatomical deformity related to the spine, cervical spondylosis, muscular dystrophy, prolapsed intervertebral disc, slip disc, paralysis, paraplegia, right? Sciatica, pain of sciatica, migraine headache, tremors, diabetes or diabetic neuropathy, trigeminal neuralgia, facial palsy, lumbar spondylitis, frozen shoulder, carpal tunnel syndrome, joint pains, muscular pains, and joint pains. I think our list is covered in this entire paragraph itself. And these are the regular routine cases that we get in our OPDs, right? Very regular cases, and patient we want to help them by helping them throughout by teaching them this marma chikitsa. So most of the disorders are covered in this. Fine. So next we have to stimulate them by giving the pressure. So what is the history behind our marma therapy? So basically, as I said, it was a part of self-defense mechanism. So where they were applying the martial arts. So from which time? From the time of the Rig Veda, from the Vedic times only, martial arts was there. Dhanur Veda also was there, which they say it is a Upaveda of Yajurveda. Okay, this is one of the four Upavedas or secondary Vedas. So from that time onwards, we are having this word as marma therapy or marma chikitsa. So first time the word was used in Atharva Veda. During the Vedic period, knowledge of marma was known by kings and warriors. So that's why I told it was used in warfare as well as in surgeries also. So where do we find the references in Mahabharata then? So in Mahabharata also, we have the word as marma or we have the word as varman there. Okay, for example, Bhishma was sleeping in the bed of arrows. We have seen all this scenes in the Mahabharata, right? So in the recumbent position, he will be lying on a bed of arrows, and he died on the day of Uttarayan because his marmas were protected by the arrows. Okay, so this is another reference where we find about the marma in Mahabharata. In Ramayana also we are going to have so many references. So they say when Lord Rama hit the arrow to the navel of the Ravana. Okay, navel means umbilicus, where there is Nabhi Marma. Okay, so he hit the arrow struck there in the umbilicus of the Ravana, and thereby he died. And also they say that there was Amruta. There was Amruta or the nectar in the umbilicus of the Ravana. So which was through the fire, it was dried up after Lord Rama shot into the navel of the Ravana. So that Nabhi Marma also we consider it as a Marma. Next, when Lakshman became unconscious, syncope of Lakshman, and Lord Hanuman goes and gets the Sanjeevani, right? So Lord Ram, so that case is also very much related with this unconsciousness where he becomes unconscious. So that also is an example or a reference. And Lord Krishna himself died by an arrow which was hit by a hunter. So where did that arrow go and hit him? On the Talaridaya Marma. So if you have seen that scenes or the pictures or images, now also you can get them when you're seeing them. So that spot where the hunter had used an arrow, so was exactly on the sole of the foot on the plantar aspect where our Talaridaya Marma was located as it. Then Shravan Kumar died from an arrow hit at their Sthapani Marma. Dasharatha, when he shot, so Shravan Kumar, the arrow which was hit was exactly at the point where we apply our bindi. So that point we call it as Sthapani Marma. So there's so many good references we have regarding this in the Ramayana also. In Kautilya Arthashastras, so they used to use the kavach. Kavach is some protective kind of ornament like which was used for covering the areas of the chest as well as the shiras. So chest as well as the shiras was used as kavach. So which was already told at the time of Kautilya's Arthashastra. So there also they were using it for self defense mechanism. So use of arrowheads and made up of steel, they were made up of metal, and some protective instruments against the injury to marmas. Then Siddha system of medicine, there is a reference. Charakacharya has told about this, right? So where has he told this? This was told in Trimarmiya Adhyaya, Sutrasthana Trimarmiya Adhyaya. So three marmas he has told, right? Hridaya, Basti, Shiras. So he has told like that. Sushrutacharya exclusively dedicates a chapter on Marma Sharira, sixth chapter, Sharira Sthana, sixth, right? Totally, he describes the whole chapter which is having the total detailed explanation on marmas. Vagbhatacharya also gives a special place for marmas, and along with Dhamani marmas as an additional entity, even Bhava Prakasha also is going to be of the same opinion. So he also has given the references. And this is just out of interest. I have put this, a very famous Australian cricketer. We know this, Philip Hughes. He died on a cricket ground, which is caused by the hit by a ball in Shankasthana. This had come in the news, and a lot of discussion had happened on this. You can see, open the article and read about the details of this. So where was the hit of the ball? On the Shankha Pradesh, a temporal region. So which is actually a Sadhyo Pranahara Marma. So Sadhyo Pranahara Marma is instant death, right? So this is one out of interest. I have put this example here. So please take a look of this marmas, thanas. Just go through these marmas, thanas. So until and unless you are not knowing the location of the marmas, you will not be successful in doing the marma therapy or marma chikitsa. So for example, let's start from lower limb. Just to go on observing the diagram. First, what we get in the pada is we get kurcha marma. Above that we get kurcha. First is we get is Kshipra, next to that we get is Kurcha, above that we get is Kurcha Shira. Okay. Next, we are going to arrive at the ankle joint. We call it as Gulfa Marma. Above that, we are going to get the Janu Marma. Janu Marma is our knee joint, right? Knee joint. But just 4 angulas below the Janu Marma, we are going to get the Indrabasti Marma. What we are going to get? We are going to get the Indrabasti Marma. Next, again above 4 angulas above the Janu Marma, we are going to get the Ani Marma. We are going to get the Ani Marma, and above the Ani Marma, we are going to reach the Urvi Marma. We are going to reach the Urvi Marma, and the joint what is there is the hip joint, hip joint, and above that we are going to reach that junction. We are going to reach is the Guda Marma, which is an example once again for the Sadhyo Pranahara Marmas, right? So now whatever the list I have told, the same list holds good even in the upper limb. So in the upper limb also, if we are starting with our palmar aspect of the hand, okay. So in the palm again, if we are having the Kshipra Marma, below that we have Kurcha, next little more below we have Kurcha Shira. From the root of the thumb, you have to trace downwards. 2 finger below the root of the thumb, we arrive at the Kurcha Shira Marma. Immediately after that, we are having which joint? We are having wrist joint, which is Manibandha Marma. There we had Gulfa Marma. Here we are having Manibandha Marma. After that, which joint will come there? Elbow joint will come there, which is that Kurpara Marma. It is Kurpara Marma. Now, next, below Kurpara Marma, 4 angulas below the Kurpara Marma, we are going to have the Indrabasti Marma. So Indrabasti is there even in the upper limb also. So again, 3 angulas above, if we are moving 3 angulas above the Kurpara Marma, we are going to arrive at the Ani Marma. We are going to arrive at the Ani Marma. So again, above that, we are going to have the Bahvi Marma. We are having the Bahvi Marma. So then above the Bahvi Marma, we are going to arrive at the proper shoulder region. So proper shoulder region, we are having the Kakshadhara Marma there. Kakshadhara Marma. Okay. And little below the ears, okay, just below the ears on the lateral aspect, we have the Amsa Marma. We have the Amsa, not Hamsa, Amsa, I, Okay, Amsa means scapular region. Okay, so these are the marmas which are in connection with the upper limb, Urdhva Shakagata. Okay, now again, if you see here, Nabhi marma we have understood. Basti marma is in the region of the hypochondrium, correct? Hypochondrium, 9 quadrants of the abdomen. We have hypochondrium, Basti marma is a place for that. Below that we are having Lohitaksha marma. You can see in the diagram. So Lohitaksha marma is there. Fine. And in the chest region, we are having landmark. We have to take the landmark as the nipple there. Nipple is the landmark. So 2 angula above the nipple is Stana Rohita marma. 2 angula below the nipple is the Stana Mula marma. Okay. So above that, so whenever there are any Kapha Koshtataya conditions in relation to the lungs, then by stimulating these two marmas, the person will be getting clarity from that. The Kapha Koshtataya can be relieved, as well as the other hydrothorax, pneumothorax, and allergic bronchitis condition. These can be relieved by stimulating the Stana Mula and the Stana Rohita marmas, which are coming in the Urogata. Uras is chest region. Okay. Related to that, we have again Apalapa Marma and Apastamba Marma. And then if we are now going above, then we are having Nila Manya Matrika Marmas, which are totally related with the blood vessels of the neck, carotid vessels. Okay. So Nila Manya Matrika Marmas. And on the nape of the neck, so where we put hand behind, from behind the neck, we call it as nape of the neck. On that part, we are going to get the Krikatika Marma. Krikatika Marma. Okay. Then let's go to the face now. In the face, on the nose, we have Fanamarma, right? Fanamarma, and where we apply the bindi or tilak, that is Thapani Marma. And exactly on the Brahmarandra, we are going to get the Adhipati Marma. Adhipati, he is the Raja of all the Marmas, controller of all the Marmas. And Chakra concept, they say it is the place of or the opening of Sahasrara Chakra, Adhipati Marma. Okay, Brahmarandra we call it as. Also we call it as Brahmarandra. Fine. So that is one. And then on the lateral canthus of the eye, we have Apanga Marma. We have Apanga. Above that, on lateral sides, we have Avarta Marma, Utkshepa Marma. Shankha Marma is on the temporal aspect, on either sides of the temporal bones. Okay. And one more we are having is Simanta Marma. Simanta Marma is where we have the sutures. So frontal lobe is there, parietal lobe is there behind that on either sides. Most behind posteriorly we have occipital lobe, right? The sutures which are connecting these lobes, that point we call it as Simanta Marma. Five are there. Five sutures, cranial sutures. So they are regarded as Simanta Marma. Okay. So these which I have told you just now, these are from anterior view. These are from anterior view. And the same marmas you can even stimulate by the posterior view also, right? And the posterior view marmas, basically we are going to see the Amsa Falaka. Amsa Falaka, we cannot palpate it from front because scapula is behind. Okay, shoulder blade is in the posterior aspect of the upper back. So Amsa Falaka marma can be stimulated only from the posterior aspect. And Bruhati Marma, you can see in the diagram where our trapezius muscle is going to come and show one of the point of origin, right? So Bruhati Marma also can be stimulated only from the posterior aspect. Then come little more below near the low back pain. In the upper back, we are having Amsa Falaka, Bruhati Marma. In the lower back, we are going to have Parshva Sandhi Marma. So Parshva Sandhi Marma, if you're seeing in the diagram, so you can understand it is the renal angle, isn't it? When the person comes walking to our OPD, keeping his hands, he keeps both of his hands on the without his nala. He won't be knowing that it is the renal angle. So when he puts his hands on the waist, that point is renal angle, and that is the site of Parshva Sandhi Marma, right? Just below that, we are having Natamba Marma. Nitamba Marma. And sacroiliac joint, there we are having Kukundara Marma. You can see in the diagram, Kukundara Marma. Okay. So these are the specific marmas which we need to stimulate, or we need to do the therapy from the posterior aspect only. Okay, posterior aspect. Katika Taruna is also there where we wear the belt. So totally on the lower back sacroiliac joint. So there Katika Taruna Marma is there. So to prevent from the back pain. Okay. So these are the marmas names. You have to be familiar. Okay. There is no need of knowing about the Angula Pramana, etc. for knowing the marma therapy. But certainly you have to be thorough with the location of the marmas. location of the marmas you should be in your mind. If that is there, then you think you have learned the marma chikitsa. Okay. So if this diagram is clear, so you can see any of this diagram. So you just have a look for 2 minutes. I'll just give time for 2 minutes. Please have a look of these marmas. Nitamba marma, Katika Taruna, Kundara, Buddha marma. So also you should know specifically which marmas can be stimulated from anterior perspective, which can be stimulated from the posterior perspective, Shadanganusara wise. Okay, Shadanganusara means what I'm trying to tell you is from all the aspects, whether it may be in upper limb, lower limb, Udara, Uras, or Shiras, Urdhva Chatrugata, whatever it is. So specifically, you need to know whether it comes anteriorly or whether it comes posteriorly, right? Fine. So one more diagram showing you the face marmas. Shringataka marma is the junction point of the four marmas there. Nasa, Jivagrana and this one. So Fana marma is related to the nose. Manya Dhamani, you have to palpate it from anterior perspective. Utkshepa marma, you can see from lateral aspect very clearly. You can palpate the Utkshepa and Shankha marma. So remember, they are in one line almost. Utkshepa, Shankha, Apanga, Marma. All these are very neatly palpable or stimulated, can be stimulated neatly from the lateral aspect. You should stand on the side of the patient and then you have to stimulate these marmas to give him the relief. Okay. And posteriorly, you can see there, Simanta, I have marked the Simanta is there in the diagram. Krikatika marma, I told you on the nape of the neck, right? Okay, then Siramatrika marmas. So we need to stimulate these marmas thoroughly from the posterior aspect. Okay, see, Avarta marma, Apanga, all suffering from shoulder pain. Suffering from shoulder pain. Then what we have to stimulate? We have to stimulate the Kshipra marma and Kurpara marmas. Very important marmas there because shoulder pain, initially if it is a shoulder pain, fine. So later it can cause shoulder, frozen shoulder. Stimulating the marma from the root, which is at the root level, Kshipra marma, right? So Kshipra marma, you have to press and release the Kshipra marma there. So between the thumb and the first finger, Tarjani, between the thumb and the Tarjani, what we have is Kshipra marma. So take your right hand, so you use your thumb and the Tarjani and stimulate the Kshipra marma. How to stimulate? You just have to press and release, press and release, press and release. Okay, so 0.8 seconds is what is told as the normal stimulation time. That is our cardiac cycle time, right? So press and release, press and release, press and release. Okay, so same you have to do it on both the sides. Whether he has the pain unilateral, but still assure that you do it on both the sides. Okay, and they also say that in males you have to do it on the right side first. In females you have to do it on the left side first. Okay, because they say there is a connection about the ida pingala nadis, they get connected. So that's the reason they say always on the males you start for the stimulating on the right side, then you have to do on the left side, and in females on the left side. Okay, and any abdominal case, we have abdominal pain, so again we stimulate the kurpara. Where is kurpara marma? Our elbow joint. So elbow joint, how you know elbow joint? In the elbow joint we are having the lateral epicondyle and medial epicondyle. So try to hold both of those with your fingers, with the thumb and your another middle finger on either sides. You can hold the lateral epicondyle and the medial epicondyle, and just as I said, press release, press release, press release. You have to do that. Okay, so how long will you do like this? You will do it for around 12 seconds, 15 seconds. Okay, so basically without any pain, if you are doing it as a routine to prevent from some pain, routinely if you are doing it, then you can start stimulating till 5 counts. So 5 counts is more than enough twice daily. Okay, normally if you're doing. But in these conditions, diseased conditions you're doing, so 15 to 18 period of time is what you're required to do it. Okay, on both the sides. Individually, you have to do it like that. So Kurpara Marma, I told you. Urvi Marma, so above that you have to stimulate the Urvi Marma. Then we have chest pain or the cervical pain, I mean chest pain. The person has chest pain, then stimulate the Kurpara Marma, Urvi Marma, and Ani Marma. Ani Marma is much more above the elbow joint, 3 angulars above the elbow joint, because we are going towards the chest means whichever marmas are coming in contact with the chest region, so all those marmas needs to be stimulated. So stimulate all this. Again, when I'm saying stimulated, try to give good pressure. Try to give good pressure by doing the exhale, inhale, press, and release there. Okay, cervical pain when one is having, very very common. This is by seeing laptops, by seeing mobile phone, watching TV, working under the system continuously, right? Neck pain is very common in even children now, school going children also. So please stimulate them right from the Kshipra Marma, proceed to the Kurpara Marma, lastly you stimulate the Ani Marmas. We can help our children regularly by stimulating these marmas to avoid the neck pain in them, right? So stimulate Kshipra followed by Kurpara followed by Ani Marma. Ani Marma is very very important, which is must to be stimulated to avoid the neck pain. Okay. Then commonly I have written when there is leg pain, specifically knee pain, sciatic pain, then Kshipra Marma and Gulfa Marmas. These are compulsorily to be stimulated. I could have written much more names. So Kshipra, Talarudaya, okay, Janu, Undrabasti. I could have written many other names. But why I have given highlighted these two marmas is because these are mandatory to be stimulated or given pressure at this side. Gulfa marma is very very important, where we create a hook like thing and we give the marma therapy there. Okay, so Kshipra Marma and Gulfa Marma not to be neglected at any cost. Okay, in case of sciatica or in case of any kind of knee pain, it may be knee osteoarthritis or it may be some tendon inflammation, prepatellar tendon inflammation, whatever it is. So you should not forget to stimulate these two marmas. Fine. And cerebral palsy, so stimulate entirely the Urdhva Shakhagata and Adho Shakhagata marmas. Okay, Urdhva Shakhagata and Adho Shakhagata marmas has to be stimulated. Definitely, I know it will take lot of time in your OPD, but can't help. So some cases are like that where you need to give time. They also need to give time for you to get rid of it. You need to do this with good precaution and spend good amount of time with the kids. Then cervical spondylosis also, you have to stimulate the upper extremity, all the upper extremity marmas. Cervical spondylosis, cervical spondylitis, torticollis, all these cases. So from where you will start stimulating, you are going to start from the Kshipra marma first. So I'll tell you the order. You can note down the order. So first you have to stimulate the Kshipra Marma. Then you have to come to the Talarudaya Marma. I'm sorry. After Kshipra, you have to go little down and reach the Kurcha Marma. From there, you will come down below the root of the thumb to reach the Kurcha Shira Marma. Once these three are over, then you have to shift your finger or the thumb to the Talarudaya Marma. Talarudaya Marma, which is almost at the center of our palmar aspect. So from the middle finger, if you're drawing a vertical line and reaching till the center, so that almost it will reach the center of the palm. So Talarudaya Marma, Padatala, Panitala. Okay, stimulate that one. Okay. After that, come to Manibandha Marma. Manibandha Marma is wrist joint. Okay. So put your fingers on either sides of the wrist joint, on the lateral and I mean, on both the lateral aspects. Okay. Hold it tightly and try to do the rotation of the wrist joint. Clockwise rotation 5 times, anti-clockwise rotation 5 times. Okay, it is mentioned that you have to do for 20 times, but practically you should be little conscious when you're doing. Severe pain if he is having, you cannot ekdam say force him to do for 10 times, right? You should motivate him by at least passively doing it by 5 times at least. That is enough for that day. Twice if you're doing, it's enough. Okay, rotate clockwise, anti-clockwise, 5 times each. After Manibandha Marma, then reach the Indrabasti Marma. How do we reach Indrabasti Marma? So Kurpara Marma, below the Kurpara Marma, you have to keep your 4 angulas. Okay, so once you keep the 4 angulas, that below that 4 angulas, that point, central point will be known as Indrabasti Marma. Okay, Indrabasti Marma. So in that case also you have to stimulate that also, anteriorly as well as posteriorly. Okay, anteriorly as well as posteriorly you have to stimulate this. After Indrabasti, go to the stimulation of the Kurpara Marma, elbow joint, like as I told you. So you have to take the lateral medial epicondyle and lateral epicondyle and medial epicondyle on either sides. You have to keep it in extension, not in flexion. So extend your hands, extend your forearm, and on either sides of the Kurpara Marma, try to press and release. So you feel a little spark. Okay, you should feel that. If you're feeling that, then you're doing correctly. Simply if you are doing monotonously and not feeling anything, then, and if you are feeling pain also, it is good. You try to withstand the pain. There is no problem in that. So you should feel like a jerk, like when you are stimulating the Kurpara Marma. So do it on either sides. Okay. So after that, you are going to reach to the Ani Marma. How do you reach Ani Marma? 3 angulas above the Kurpara Marma, we will reach the Ani Marma. Okay. After Ani Marma, come little more above, locate at the center, almost at the center of your arm. So we have Bahvi Marma. So press and release at the center of your arm, little medially. Little medially means to the inner aspect. Little to the inner aspect of your arm, right? So little medially you stimulate from the center. Okay, so after that, reach to your shoulder joint proper. Reach to your shoulder joint. Okay, so now that you have kept your hand on shoulder joint, go little above, 2 or 3 angulas above. Okay, almost you're on the lateral aspect of your neck, center of your neck. Okay, center of your neck. So Kakshadhara Marma. Try to stimulate that. Okay, so easy way is you can feel your clavicle bone on either sides. Okay, lateral one third of the clavicle, you locate the lateral one third of the clavicle. Okay, go little above that and in front. So when you reach there, then that is Kakshadhara Marma. So finally, you should reach till there and you have to stop your stimulation there. Okay. Okay, don't come much more below. If you're reaching much more below and medially, then you will be injuring the brachial plexus there. So see that you don't injure the brachial plexus. Okay, so this is the sequence how you have to do the Marma Chikitsa in case of these torticollis, cervical spondylosis, spondylitis, frozen shoulder, tennis elbow, these conditions. Remember the order, not just whatever you remember the marmas you have to do. There is a sequence for this, there's a pattern for this, there's a technique for that. And there is also something known as nature, how much pressure has to be given. All this you have to keep in mind and then help the patient to relieve the pain. Okay, remember the order for this. For tennis elbow, you can stop at Ani Marma. There is no necessity of stimulating beyond Ani Marma because tennis elbow is one such condition where where the person has inflammation on the lateral epicondylitis, right? On the lateral epicondyle of the humerus, the person is having the inflammation. Movement restriction is there on that side. So that is the reason mainly you stimulate the Kurpara Marma, then little above Ani Marma, so that the person doesn't have the muscle fatigue. Okay, so you can stop the Marma Chikitsa for tennis elbow there. No need to go beyond the Ani Marma, right? So I think this has helped you. at least in to some extent, how to do the sequencing, how to know the pattern of doing the marma chikitsa. So pain management aims at minimizing distress, right? Feeling active. Okay, once you finish this, ask the patient to do the movements. Frozen shoulder if he has come, or tennis elbow if he has come. So you know, just note the range of movement before treatment. And once you give him this marma chikitsa, then tell him to do the movement. Certainly, I'll tell you at least 20 to 30% he will be better minimum. Okay, so he feels very fresh, he feels very active. And if it is more than 70%, he says as though I didn't have the pain. So to that extent, it relieves faster the instant pain for the patient, thereby improving the quality of life, right? This is uncomplicated, most easy to learn technique of regaining the vital energy. Prana is obstructed. We need to remove the obstruction of the prana by Marma Chikitsa. And what are the postures we can adopt? So these are the postures we can adopt. We can sit in simple Sukhasana and do the Marma therapy. Padmasan is also good. Ardha Padmasan is also good. Vajrasanto, especially when we are stimulating the lower back marmas, right? Lower back marmas, like I told, Parshva Sandhi marma, Katika Taruna marma, Vitapa marma, Nitamba marma, right? All these things, if you are stimulating, sitting in Vajrasana will fetch you very good results. Okay, and then this is simple sitting posture on chair. So chair Surya Namaskara also we do, right? So similarly on that in the same position we can also do the Marma therapy. And standing posture, and in exceptional conditions when they are having some ankylosing spondylosis, okay, scoliosis, some anatomical deformities are there in exceptional cases, then we can do it in lying posture also, recumbent position, either in the left recumbent, lateral recumbent, I mean in the wherever person is comfortable, whether he wants to turn on the left side or right side, whichever he finds comfortable. So in the recumbent position also we can carry out this Marma Chikitsa. So you should know properly the poses in which we have to do this Marma therapy. And person should be in a steady phase. He should not have any stress. In a calm environment where there is no noise, you have to do in that place. And mentally he should be alert, because later now you will do the marma therapy for them today. So every day just think, if he cannot come to your OPD for 10 days, if you're asking him to come for 10 days, he is unable to come for 10 days, he is going to learn it. So it becomes self marma therapy. So he needs to stay mentally active throughout the session, right? And sitting posture, obviously it is always more convenient. Okay, otherwise in sitting position also, not just simply sitting, so you're sitting keeping your spine erect. Okay, that is very important. You have to keep the spine erect. Only then you will be able to concentrate. Or and you can assume the dhyana mudra. You can assume the dhyana mudra also and start concentrating on the marma therapy. This is the technique, simple technique. Then and sitting and standing, so neck and spine should be in a straight line. So you should not tilt your head in any direction. So this happens very commonly when we are stimulating the neck marmas. Without your knowledge, you will be tilting your head, or when we are applying the pressure, some stimulation is happening, so automatically there is stiffness. Okay, you should not have the stiffness. You should leave the things freely. You should relax first, and then only we can do successfully the marma therapy. If you are doing in the standing position, then the feet should be parallel to each other, so arms should be hanging loosely from the shoulder joint near to the body with open palms facing inwards with straightened fingers, right? So actually this is the definition of anatomical position. First year BAMS, when students enter the class, anatomy class. So in first 1 or 2 days we teach them this, right? What is the normal anatomical position? So standing in the normal anatomical position also we can carry out this Marma Chikitsa. Right. So then what are the pre-therapy exercises? Totally your body has to be relaxed physically as well as mentally. Mentally how? By doing some inhale, exhale, deep breathing exercises. Right. Then perception of a body as a whole, psychic centers. That means mentally you need to stay active. And then you, once you are mentally staying active, automatically perception of karma points. You will be understanding where all we are applying the pressure, which all points we are applying the pressure, in which order we are going, and how you should also do if you are not able to come on regular basis, right? So these pre-therapy, you have to do it. Only after that we are going to start the actual marma therapy. How do we do this? We stimulate them, okay, or we can apply the pressure over the fingers or with the help of our thumb or the fingers, okay. And some people, what they do is they take this aromatic oils, okay, so just to keep them mentally alert or to divert their attention. So aromatic oils, lavender oil is there, jasmine oil is there, rosemary oil is there. So many aromatic oils we are having now in the market. So you can just drop 1 or 2 pinches of the aromatic oil on that marma site, and then also you can apply the pressure. Or some people, what they do is, so frozen shoulder if it is there, so totally with our vatahara tailas, okay, mahanarayana taila, whatever it is, prasaranya taila, whichever is the taila, so warm it and just do an abhyanga. After that also you can do, start doing the giving the pressure on the marmas. So that is also by doing abhyangam also, it gets stimulated, then you can give the pressure. Okay, so there are different ways how we can do this marma chikitsa or marma therapy. So pressure should be given. So in Samhitas they have told that, so always the pressure has to be given maximum. As much as possible you need to give the pressure. Especially if it is related to asthi and sandhi marmas. If it is related to asthi and sandhi marmas, so you need to give the pressure maximum as much as possible from your end. Okay, so if it is Sira Marma or Snayu Marma, then you have to give little less pressure. Okay, if it is Mamsa Marma, you can give moderate pressure. Okay, Mamsa Marma, you can give some moderate pressure. Sira Marma, Snayu Marma, you can give little less pressure. And especially when it is Asthi Marma or Sandhi Marma, give the maximum pressure to have the quick pain relief. Stimulation time, I told less than 1 second. So point, just press release, press release, press release is what you have to do. 3 times minimum person has to do. 3 times per day to get the best results he has to do without laziness. And repetition, how many times we have to do the press release? Minimum 15 to 18 times in single sitting. That is applicable only on one side. Remember this point. Okay. So I told you right side and left side. Okay, right side if you're doing also, you should do first for 15 to 18 times each marma point. Same you have to repeat on the other limb also, each marma 15 to 18 times. So I know it consumes time, but the fruit, after doing so much, after spending so much of time from both the ends, it is having a fruitful result. Okay, so never mind for that. So this is the protocol, or we call it, we can say it as SOP also. SOP for doing the marma chikitsa. The general rules, these are our general rules. So we are doing marma chikitsa, so we have to trim our nails. It should not be that our nails only should not become the shalya for them, right? So you are not going to do idiopathic any cause there. So you have to trim your nails properly, shape them, and then only you have to do the marma. Don't talk to others while rendering marma treatment. Only you and your patient, that's all. You and your patient, not, you are not going to receive any call, talk to others, don't divert. If you are not serious, obviously you can't expect the person also to be serious there, right? So simple thing. And then twice a week, tell him to come for 10 days, 7 days, twice a week depending on his condition, right? Otherwise teach him in a proper way so that he can practice it twice or thrice on regular basis. And indoor patients who are admitted, so this can be administered once in 6 hours daily, that becomes 4 times daily, right? So like this you have to do it. And after finishing the marma therapy, this is important, you have to touch the wall or any wooden objects, because so much of heat will be transferred from your end to the patient. So for that sake you should touch the wall or you have to touch some wooden objects to further do the marma therapy on the next person, right? Then dietary restrictions, and also this we say that like at least 4 hours before you have something. After that, don't have anything, because first time if they're doing, if they're little scared of it, so they may have nausea or vomiting. Okay, so to avoid all that upsets, okay, especially abdominal murmurs if you're stimulating, uragata murmurs you're stimulating, so then 4 hours before let them have some light diet and come to you. Okay, and curds is not to be advised at night, greens to not to be advised at night, so we know this since ages. Okay, pressure has to be given based on the age and body condition, so this we know this. And don't administer this therapy one who come with snake bite, scorpion bite, or poisoning cases. You should, apart from knowing in which it is there, you should also know very importantly the contraindications when you should not do. And preferred time is always before suryasta. Okay, suryasta early in the morning you can do this. Okay, after attending the nature call you can practice this. Okay, that is the best time for practicing. So these are some general rules. Then these are the techniques we have discussed. Okay, stimulating to gain the benefit effects. So massaging is one way where which we'll call it as abhyangam, right? So I told you aromatic oils can be used, or our therapeutic oils can also be used. Okay, or if nothing is required, so simple pressure also can be used. You wear the gloves and give the pressure. Simple the technique. Herbal methods are used in the form of herbal paste. We do Shashtika Sharipinda Sveda, isn't it? Tying with the potali, we do that, isn't it? We use some pastes for application. So that also is a marma therapy only. Okay, only the method we are adopting is a herbal paste or potali we are taking and we are giving the pressure there, isn't it? Acupuncture indirectly is also a marma therapy only, where we prick with the needles, that's all. Heat application, Svedana, giving Svedana is also stimulating the marmasthana. Okay, so many methods are there. So we all get this under different headings, that's all. So potali, Svedana. Okay, when we are doing this, we are telling there as Panchakarma, isn't it? Okay, Snehana, Svedana, dry massage, Udvartana. Okay, deep pressure points, application of herbal paste, puncturing with a needle, that is in acupuncture, right? Marma, which includes the massage, pouring oil, Shirodhara. So when we are taking Shirodhara, that is also stimulating the marmas only, right? So we are stimulating Simanta Marma, we are stimulating Uchepa Marma, we are stimulating Shankha Marma, we are stimulating Avarta Marma, isn't it? So many marmas we are stimulating when we are doing the Shirodhara. Pichu, Shiro Pichu when we are keeping. Okay, what we are stimulating there when we are doing the Shiro Pichu Dharana? Rasna Chura you are applying. Thandi ke din mein you apply Rasna Churana, isn't it? Brahmarandra, which is the marma there? Adhipati marma. So unknowingly we are doing this, but we are not aware of it. That's all. Okay, so that is also there. So just compiling those will give you a beautiful result. Yogasanas. So yogasanas, I told you different postures which we are adopting in the beginning beginning. Sukhasana, Ardha Padmasana, Vajrasana. So when you are doing Vajrasana means you are stimulating there without your knowledge, you are stimulating the Kukundara Marma and you are stimulate the Nitamba Marma there. Okay. So pranayama technique, meditation techniques helps to stay you mentally active, alert to learn the marma therapy. Okay, so these are some interesting things. So, which are different methods of stimulating the marma points or the vital points. So, why we do this? To remove the obstruction and to retain the prana of a person. So this is also to be known. So we should apply the pressure in accordance with the heartbeat and the respiratory rate. So diabetic people, hypertensive people, check this that they're not that they have come for memory. I mean therapy, marma therapy. Just do the marma therapy and send them. No. So minimum check the pulse rate, check their BP. Then you take a call how much pressure you have to give, for how long you have to do it. So that all comes with practice. Okay. So identification of marma point is the first thing. Giving proper pressure of the marma point with the help of thumb and finger, relaxation of marma point. After your marma therapy is over, let them relax in shavasana. Okay, give them some good time to relax, then you can send them home. That means this is done on OP basis, right? Daycare procedure, not even procedure. So on OPD basis only we are doing this and sending them back home. So then what is the mode of action of doing this Marva Chikitsa? Okay, so mode of action is proper flow of prana. So many times I've repeated this, clearing the avarodhana, enhancing the energy flow. Sandhi and Vayu are the sthanas used for Marma Chikitsa because that is where anatomically we get disabled, isn't it? Fractures, dislocations, inflammations, isn't it? Tendonitis, tears, ligamentum tears, all this we get in that site, isn't it? So with more pressure, we need to stimulate them. Then they help in balancing the three doshas and our three gunas. Okay. Then these are some of the things. So totally they improve the enhance the circulation of our body. They help to remove the sroto dushti. So you can attain the physical, mental, spiritual well-being. I also want to add the word here spiritual. So not only physical, mental. So your spiritual well-being will also be very good. Emotionally also you will be very stable, especially when it is manasika karana. So, emotionally and remaining spiritually and emotionally active becomes more important than you being physically active, right? So, clears the ama, toxins, and this is clinically applicable for many diseases, especially even the heart problem also. Talarudaya marma. In the name only, there is the meaning of this. Okay. So this is the reason, the mode of action, what you get after doing this. So endorphins, your happy hormones will be stimulated. Okay. So serotonin will be stimulated. So because of which you go into a good sleep in case of anxiety issues, depression issues, right? Yes. And benefits, I think it's almost same as this mode of action. So mana prasannata, manasika prasannata, spiritual well-being, emotional well-being. Your asthi snaya, siras and these will become more balaprada. Okay. So as a preventive measure also we can do this marma chikitsa. Not only you wait for some injury to happen and then you do this. As a preventive measure also we can start doing this. Once we learn this, there is no problem in doing this on regular basis. At least though we are working, if we have the mindset to do it, at least once in a day we can do this. This is not impossible job. Okay. So it helps to stimulate all your dhatus, sapta dhatus. Positive energy is there throughout the day. So now you should tell me which are these marma points. So now you can see this. First one, what they're stimulating. They're stimulating the Talarudaya marma on the dorsal aspect, isn't it? Same can be done on the palmar aspect. Second image, if you are seeing, they're stimulating the Sthapani marma, isn't it? We call it as in anatomy the point as glabella. We are stimulating that point. In the third image, you can see they're stimulating on the nape of the neck in prone position. Okay, then coming lower down on the neck, I mean on the back, center of the back, almost at the Brihati Marma point. And in the fifth image, okay, lower down, where they're stimulating the Matrika Marmas. Okay, Matrika Marmas, they're stimulating, or the Krikatika Marma. And here in the last image, they're stimulating the Utkshepa and Shankha Avarta Marmas there. Okay, so this is how they stimulate. And here I have shown some potali. I told you, right? They you can use the potali by tying the potali. What is there inside that? Herbal paste would be there. Churna may be there. Okay, you're stimulating by giving some heat application, right? So second image, which marma it is? Kurcha Shira marma, isn't it? I told you, root of the thumb, 2 centimeter, 2 angulas below, we arrive at Kurcha Shira marma. So any constipation issue is there, indigestion issue is there. So this can help you. So see in the plantar aspect, that is the place of Talarudaya marma. Plantar aspect, center of the soul, Talarudaya marma. So throughout the day, it keeps you active. It prevents from diabetes, hypertension, hypothyroidism, these issues. Okay. Then last image is also stimulating the Talarudaya marma. Okay. Now, first image which you are seeing is Kshipramarma, point of Kshipramarmas. Stiffness is there, so you can relieve the stiffness. In the second image, you are stimulating once again the Kshipramarma on the dorsal aspect, isn't it? Dorsal aspect. Third, you are stimulating Talarudaya Marma on the palmar aspect. Okay. Then below down, we are stimulating Kshipra again. And central diagram, we are stimulating here the Kurcha Marma. We are stimulating the Kurcha Marma. Okay. For all your abdominal issues, abdominal pain, colicky pain related issues. Then last diagram, if you are seeing on the right side, that is Indrabasti Marma. Okay, this is also works wonderful, especially in genitourinary diseases as well as in our regular diabetes conditions, hypertension conditions, hypothyroidism conditions. Indrabasti, name itself will tell you. Basti means bladder, so related very much with the urinary system. And there are so many complications related to the urinary system in diabetic patients, isn't it? So Indrabasti Marma becomes very important to be stimulated and hence get stabilized. Then we are stimulating here, first diagram, we are stimulating the Sera Nila Manya Dhamanis at that point. Then above, we are stimulating the Avarta Marma. Then third diagram, again we are keeping a point at the center, stimulating the Sthapani Marma, and our fingers are on the either sides, stimulating the Shankha Marma. Shankha Marma. And then we are stimulating the Shankha, near the Fana Marma. Okay. And lastly, we are helping the patient to relieve from the back pain by stimulating the Kukundara Marma there on the sacroiliac joint, Kukundara Marma. So many images I have put. See, the second diagram is interesting, isn't it? He has kept a foot on the back. Kalari, it is called Kalari Marma. In Kerala, they use this method. Kalari Marma. So in athletes and all, when they suffer from this, they are not just they keep just like that. Some amount of pressure is given. So Kalari art, you might have heard. See the other diagram. Shashtika Shalipinda Sveda, stimulating the marma. And some pictures I have put here showing you the marma stimulation points in Indrabasti marma. Gulfa marma is very, very important. I told you in any of the lower condition, lower limb diseases, Gulfa marma and Kshipra marma mandatorily has to be stimulated, both from the inner aspect as well as from the outer aspect. Okay. Then the first diagram is stimulating the Indrabasti marma. Second diagram, we are stimulating the Amsa Falaka marma, Amsa as well as Amsa Falaka marma there. Okay. So muscle wasting, if it is there, if there is muscle wasting stiffness in the scapular region, because there are a lot of muscle attachments related to the scapula. 17 muscles are going to get attached there. So there are chances of muscle wasting stiffness. So then we need to stimulate there. And last diagram which you're seeing here is Indravasti Marma in the lower limb. Fine. These are the postures that I told you you can adopt while practicing the Marma Chikitsa. Sukhasana, Padmasana, Ardha Padmasana, Vajrasana. Okay, or sitting and standing posture. Chair posture and normal anatomical position. See the spine, it has to be kept erect. Neck should be erect, spine should be erect, head should not be tilted. Okay, on sitting, on standing, or either while doing it also, you should not turn your head or keep your muscles, arms stiff. Okay, I think it has helped you at least in some way today. Marma Chikitsa topic. So please remember to know the location properly, okay, which would help you to don't take it very lightly. Have faith. Certainly, you will have success in this Burma therapy. So, if you have any queries, please let me know. Hello? Do you have any queries? I've taken more time. Hello? Hello? Is it audible, madam? Hello? Hello? Hello, madam, is it audible? Audience, is it audible?